Assalamu alaikum. Hello, I am Dr. Asad Saleem. Here I am discussing about crucial topic of intrauterine growth restriction, or IUGR, is a condition that affects some pregnancies. It means that a baby in the womb is not growing as well as expected. This can be a worrying time for expectant parents. But understanding IUGR is the first step to ensuring the best possible outcome for both mother and baby. This guide will provide you with comprehensive information about IUGR, its causes, symptoms, diagnosis, and treatment. Remember, this guide is intended for informational purposes and should not be considered a substitute for professional medical advice. If you have any concerns about your pregnancy, please consult your doctor or midwife. Intrauterine growth restriction, or IUGR, occurs when a baby in the womb doesn't grow at a normal rate. This means the baby is smaller than expected for their gestational age. Babies with IUGR are often born with low birth weight. IUGR can develop for a variety of reasons, some related to the mother's health, some to the placenta, and others to the baby itself. It's important to note that not all babies born small have IUGR. Some babies are just naturally small. However, if your doctor suspects IUGR, they will closely monitor your pregnancy and your baby's growth. There are several factors that can increase a woman's risk of having a baby with IUGR. Some of these risk factors include chronic health conditions in the mother, such as high blood pressure, diabetes, or kidney disease. Problems with the placenta, which is the organ that provides the baby with nutrients and oxygen. Infections during pregnancy, such as rubella or cytomegalovirus. Multiple pregnancies like twins or triplets, and smoking, alcohol consumption, or drug use during pregnancy. It's important to discuss your medical history and any potential risk factors with your doctor early in your pregnancy. IUGR is often diagnosed during routine prenatal checkups. However, there are some signs and symptoms that expectant mothers can be aware of, such as a smaller than expected fundal height, which is the distance from the pubic bone to the top of the uterus, decreased fetal movement, and low levels of amniotic fluid. If you notice any of these signs, it's important to contact your doctor immediately. Section 5. Unraveling the causes of IUGR. IUGR is a complex condition with various contributing factors. In many cases, it's difficult to pinpoint a single cause. However, some common reasons for IUGR include placental insufficiency. When the placenta doesn't function properly, it can't deliver enough nutrients and oxygen to the baby. Maternal health conditions. Certain maternal health conditions, like high blood pressure or diabetes, can affect the baby's growth. Fetal factors. Sometimes the cause of IUGR lies with the baby itself, such as genetic abnormalities or birth defects. Understanding the cause of IUGR is crucial for determining the best course of treatment. Section 6. Diagnosing intrauterine growth restriction. Diagnosing IUGR involves a combination of methods, including ultrasound scans. These scans use sound waves to create images of the baby in the womb, allowing doctors to measure the baby's size and estimate their weight. Doppler flow studies are another method. This type of ultrasound examines blood flow in the umbilical cord and placenta, helping to assess the baby's well-being. Early diagnosis of IUGR is crucial for improving the baby's outcome. Section 7. Advanced treatment options for IUGR. Treatment for IUGR depends on the severity of the condition and the gestational age of the baby. In some cases, early delivery may be necessary. Other treatment options include corticosteroids. These medications can help mature the baby's lungs if early delivery is necessary. Bed rest is another option. In certain situations, bed rest may be recommended to improve blood flow to the baby. Your doctor will discuss the best treatment plan for your individual circumstances. Section 8. Steps to take for a healthy pregnancy. While not all cases of IUGR are preventable, there are steps expectant mothers can take to promote a healthy pregnancy. Attend all prenatal appointments. Regular checkups allow your doctor to monitor your health and the baby's growth. Eat a healthy diet. A balanced diet rich in fruits, vegetables, and protein is essential for both you and your growing baby. Avoid smoking, alcohol, and illegal drugs. These substances can harm the baby and increase the risk of IUGR. Taking care of yourself is the best way to support your baby's growth and development. Section 9. Early detection is key. Intrauterine growth restriction can have a significant impact on a baby's health. However, with early detection and appropriate management, many babies with IUGR go on to live healthy lives. Regular prenatal care, awareness of risk factors, and prompt medical attention when necessary are crucial for ensuring the best possible outcomes for both mother and baby.